Hi, my name's Luke and today I'm going to be demonstrating a comprehensive abdominal assessment. Components of this assessment can be taken and used in the pre-hospital setting, but the full assessment's not recommended in time-critical situations. So, we'll just get into it. Hi, my name's Luke. What's your name?
Hi there, I'm Matt.
Hi, so what's your date of birth, Matt?
The 8th of the 11th, 1996.
Just confirming that we have the right person.
Yep.
So after this, I'm just going to explain what we're going to do. So Matt, in a minute, I'm going to ask you to remove your shirt, and I'll just have a general inspection of you. I'll listen to some bowel sound with my stethoscope, and then I'll percuss. I'll just do some tapping, trying to find the size of some of your organs, and after that, I'll just palpate, which could be painful. And so I just have to get your consent that I'm allowed to do that. Is that right?
Yeah, that's alright.
Cool. So before I can do anything, I could look around the environment to see if there's any signs of, say, stoma bags, which could indicate previous colostomies or gastrostomies. After this, I could also look for any medications that could indicate underlying health conditions. You're not on any medications, are you, Matt, for anything?
No.
No? Right, cool. So after this, I could also look at the general appearance of my patient. He's looking healthy, he's not looking obese or anorexic, as these signs could indicate eating disorders or problems with the metabolism. So Matt, before we get into it, do you have any pain anywhere in your abdomen, but
No.
as well as like down your shoulders or in your back or anything like that?
No, I don't have any pain.
Right, the reason why I ask for pain anywhere, not specifically in the abdomen, is that the pain could be referred. For example, pain up in the shoulder tips could mean that there are irritants in the peritoneal cavity, and so the fact that he has no pain is a good sign. So Matt, I'll just ask you to remove your shirt now.
Yep, that's alright.
So again, I can just look for those obvious stoma bags or feeding tubes going into him. However, I could also be looking for scars. So I can't see any scars, and as these scars could indicate previous medical surgeries that he's needed. I also can't see any obvious bruising around the umbilicus region. This could indicate a ruptured aortic abdominal aneurysm. It could also indicate in females ectopic pregnancies, and it also indicates acute pancreatitis, and it could obviously also be blunt trauma. Another sign that these things can be picked up from is the Gray Turner sign along the flank here. If there's bruising similar to the Cullen sign, if there's bruising along the flank, then it could indicate similar things and is a result of heteroperitoneal hemorrhages. So there are also no obvious masses in Matt's stomach here. He doesn't have any hernias or caput medusae. He doesn't have a pulsating stomach, and he's just looking overall healthy from an inspection. So now I'm going to get into the auscultating side of things. So when auscultating, you want to be listening in all the quadrants. In this stage, we're just going to do the 4 quadrants, which are the right and left upper quadrants and right and left lower quadrants. So when listening, you're going to be listening for hyperactivity of the bowels, which could indicate gastroenteritis or diarrhea. I could also be hearing hypoactivity, which could indicate bowel obstructions. And if I can't hear anything between 2 to 3 minutes, then bowel sounds could be considered absent. And again, this is just a sign of bowel obstruction. So I'll just do that now. Yeah, I can hear bowel sounds. They're not sounding overly active. Another sound you can listen for is bruits. You can listen for this up near the aorta and also on the left and right kidney. So I'll just listen for bruits now. Left kidney. right kidney. So Brooks is just turbulating blood flow. It can be resulted from hypertension, but also from thrombi or artery stenosis, renal artery stenosis, and just plaque that's built up in the arteries. So listening to Matt's stomach, it seems all healthy, so that's the auscultating part of it done. So now I just need to percuss Matt. So to do this, right now I'm just going to try to find his liver and to learn the size of his liver. So this is to make sure that it's a good size. It's not too large, which could, yeah. So I'll just do that now. Listening for a change of pitch. Getting cold there, Matt. I'm getting all goosebumps. So there's a change of pitch there. So that indicates the top of his liver there. You can also come up. There's a change of the pitch there too. So the size of Matt's liver is roughly 7-8 centimeters long, which is normal. I'm also going to percuss for his bladder now. Coming down. It's good, so we know that his bladder's around here, which is useful for when we go to palpate. And we're also got to percuss for his spleen, which you could do coming along this way. We just got to make sure that the spleen's not enlarged, which could indicate splenomegaly. And so cool. So now I'm going to get into the palpating side of things, Matt. So that could be painful. I'm just going to remind you. Is that alright?
Yeah, that's fine.
So I'm going to start with a light palpation, going down about a centimetre. And as I do this, I'll be looking at my patient's expression. If I come across any tender areas, I would see changes in an expression, which could indicate tenderness. So just palpate. I'm also looking for any guarding, making sure that he's not protecting any sensitive areas. Got to go down by the sides as well, going down about a centimetre. After you lightly palpate, it wasn't sore anywhere? No? After you lightly palpate, you can go into a deeper palpation, which is about 5 to 8 centimetres, and what you're feeling for is any masses. And if you find any masses, start deep palpations now, Matt.
Yep.
If you find any masses, you'll be noting down the size, the consistency, and the location of these masses. Again, down the sides as well. No? Okay. Cool. So now we can start palpating the specific organs. So first I'll start off with the spleen. The way you do this is you push down, you ask your patient to breathe in, and this just pushes the organs down over top of your fingers, and you can feel the texture of the organs. So yeah. So I'll just do that now. Can you breathe in for me? Out. Breathe in. Out. Breathe in. So when feeling for the spleen, you're coming up in this general direction, trying to find the edge of it. If you can't find it, you can ask your patient to roll over onto their right side, and you can repeat the same experiment. So now I'll just do the same sort of thing for the liver. So you're starting down low. Can you breathe in for me, Matt? Breathe in for me. And what you're feeling for again is the texture. Breathe in for me. As the liver comes underneath from underneath the ribs, you're feeling for the texture. If it's got scar tissue, this could be a result of alcoholism or cirrhosis, and it would feel rough as if because the liver is made up of scar tissue. Now I'm going to palpate the bladder, and as you palpate the bladder, which we located earlier, you're palpating for symmetry, which seems equal to me. Symmetry, asymmetrical bladders can result from tumours, not only on the bladder itself, but also underneath the bladder as it pushes the bladder up. We also got to check for Murphy's sign. This is as you come along underneath the bladder, the liver earlier. The gallbladder is located underneath the liver. So as you ask the patient to breathe in, can you breathe in for me? It pushes the gallbladder into the fingers, and if the gallbladder was inflamed, this would be painful for the patient, and so that didn't hurt, so we're not expecting an inflamed gallbladder. Acute appendicitis causes pain in the lower right quadrant, and McBurney's point specifically, which can be located 1/3 the distance from the top of the iliac notch to the umbilicus. So 1/3 that distance, and if you palpate there, if there's no sharp pain there, if there was sharp pain, it would indicate acute acute appendicitis, After this, we can also palpate for rebound tenderness, also known as Blumberg's sign. So this is upon palpation, it doesn't cause pain, but if I was to suddenly withdraw and there was a sharp pain, that would indicate peritonitis. So that after that, we can also palpate for the aorta, which is alongside here, which we listened to earlier for Brutes. But upon palpating it, we can just try feel for a pulsation, which we can feel there. So that's alright. He's not hypotensive or anything like that, which is good. So that kind of draws a close to our kind of hands-on assessment. So Matt, you can put your shirt back on then. Cool. So Matt's a healthy individual. I'm not expecting or suspecting any underlying health conditions.
Situations that are time critical or are immediate threats to life include conditions that cause hypovolemic shock. These include ectopic pregnancies, ruptured abdominal aortic aneurysms, penetrating trauma, or other conditions that can cause perforation, such as severe ulceration or diverticulosis. Urgent conditions can include peritonitis, pancreatitis, and appendicitis. Low acuity conditions are non-life-threatening or are unlikely to become life-threatening. These conditions include gastroenteritis, hernias, cirrhosis, and cholecystitis.